Hello friends, let us learn a new topic today, that is stomach. So, stomach is the widest and most distendable part in the abdominal wall. So, the stomach, if you see, this stomach is a muscular bag where you store food. So, this stomach will have a peristalsis contractions. So, with the help of peristaltic contractions, it will mix the food in the stomach, and thus it produces a semi-fluid food which is called as chyme. It also has a pyloric sphincter in the lower end which connects the stomach with the duodenum, and with the help of pyloric sphincter, by opening or by controlling the pyloric sphincter, it can control the flow of food from the stomach into the duodenum. So what is the location of the stomach? If you see the stomach, if you see here, the abdomen is divided into 9 quadrants. One, it is hypogastric region. This is epigastric region. This is epigastric region. These are the hypochondriac region. One, the right hypochondriac, and the other is the left hypochondriac. And there is umbilical region. And then you have right lumbar, left lumbar, and you'll have the iliac. This is the hypogastric region, and then you'll have right iliac and left iliac. The stomach, if you see, it is situated in the epigastric region, left hypochondriac region, and also the umbilical region. So this is the situation of the stomach. It is placed obliquely from the left hypochondriac region to the epigastric region. So oblique placement, it is placed obliquely. Okay, if you see, it resembles J-shaped. So it is a J-shaped thing which is its long axis. It will pass downwards first, and then forwards, and then to the right, and finally it will go backwards and upwards. Okay, these are the different shapes of the stomach. The stomach, it can be reverse L-shaped, or it can be J-shaped, or it can be a semi-lunar shaped, or it can be a steer horn shaped. So these are the different shapes of the stomach. Now, what is the size and capacity of the stomach? The stomach has a length of 10 inches, and at the capacity, it can be distendable. It is variable. The distension is variable. At birth, it is just 30 milliliters. At puberty, it is 1000 milliliters. In adults, it is around 1500 to 2000 milliliters. So this is about the introduction of the stomach. Now let us learn about the external features of the stomach. Externally, the stomach has two ends. One is the cardiac end and the other is the pyloric end. It has two curvatures, lesser curvature and the greater curvature. It has two surfaces, anterior surface and below it, that is posterior surface. So let us learn first about the ends. So cardiac end. So cardiac end, here the lower end of esophagus drains into the stomach. So the cardiac end, it joins the lower end of esophagus with the stomach. So it represents the cardiac orifice. Okay. There is other end which is pyloric end. The pyloric end, it will signifies the joining of proximal duodenum or first part of duodenum to the stomach. It has an orifice which is called as pyloric orifice. The stomach is generally fixed at upper and lower ends, and it is mobile in between. Okay, so this is about the pyloric end. The cardiac end, it corresponds to T11, whereas pyloric end, it is 1.5 centimeters right to medial plane of L1. Okay, then there are curvatures. Two curvatures, as I have said. There is a lesser curvature and there is a greater curvature. Lesser curvature, it is concave. See, this is concave. This greater curvature, it is convex. The lesser curvature is concave and forms the shorter right border of the stomach. It is the most dependent part of the stomach, and it has an angular notch. Here, see, if you see here, this is the angular notch. This is also called as incisura angularis. This incisura angularis, it will indicate the junction of the pylorus and the body. So there is an angular notch in the lesser curvature, and this angular notch will indicate the junction of, angular notch, it will indicate the junction of pylorus and the body. Okay, the lesser curvature will provide, if you see the attachment, the lesser curvature, it is attached to the omentum and also gastroduodenal and hepatoduodenal and hepatogastric. To the lesser curvature, mostly lesser omentum. In the lesser omentum, hepatogastric part is attached. Okay, so that is about the lesser curvature. Now coming to the greater curvature, the greater curvature is convex and it forms the long left border of the stomach. So, at the upper end of the greater curvature here, there is a cardiac notch. This cardiac notch will separate the stomach from the esophagus. Okay, the greater curvature, it provides attachment, if you see, to the greater omentum. So, this is the greater omentum. So, the greater curvature, it provides attachment to the greater omentum. The greater omentum, it also in the lower part, it gets attached to the greater omentum. If you see the diagram here it gets attached to the greater omentum, and on one side it gets attached to gastrophrenic ligament, and on the other side it gets attached to the gastrosplenic ligament. Gastrosplenic ligament is the ligament which connects the stomach to the spleen, whereas gastrophrenic ligament is the ligament which connects the stomach to the diaphragm. Okay, so this is about the greater curvature. Now the surface, it has a superior surface. Superior surface faces forward and upwards. It also has the inferior surface. The inferior surface will face backward. Okay, so these are the different surfaces of the stomach. So let us learn about the parts of the stomach. As I have said, the stomach has a cardiac notch. It is a cardiac part which is here. Okay, this cardiac part, it is situated above the cardiac notch. So this part is the cardiac part of above the cardiac, that is here around the cardiac notch there is a cardiac part, and above the cardiac notch there is fundus. So this is the fundus of the stomach. Yeah, if you can see, this is the best diagram. Here this is the cardiac part around the cardiac orifice, and above the cardiac orifice there is, if you draw a straight line, then you will find the fundus of the stomach. This fundus of the stomach, it is at the level of 5th intercostal space, left 5th intercostal space, just below the nipple. Okay, it corresponds to left 5th intercostal space, just below the nipple, and below it there is body. This is the body, which is the major and the largest form. It is present between the fundus and the pylorus. This body is distended enormously whenever a person eats lots of food. And then the next part is pyloric part. Pyloric part is divided into, if you can see, pyloric antrum and a pyloric canal. So pyloric antrum, it is a wider part, if you see, and pyloric canal is a narrow part. And this pyloric antrum, it is separated by sulcus intermedius. Here there is sulcus intermedius. If you see, this is the sulcus intermedius. This sulcus intermedius separates the pyloric antrum from the pyloric canal. Okay, so this pyloric canal is very narrow part and it lies above the pancreas. So this is about the pyloric part, and there is one more part which is pylorus. So this pylorus has a sphincter. Here this is the pylorus. It has a sphincter, so it will stop the food from entering the stomach to the duodenum. So it helps in controlled, pylorus has controlled entry of food. Okay, so this is about the parts of the pylorus and the relations. Yeah, now what about the relations of the stomach? If you see, there are peritoneal relations and there are visceral relations. Peritoneal relations include the stomach. The fundus of the stomach is attached to the spleen by gastrosplenic ligament, whereas the other part of the second part, the later half of the fundus is attached to the diaphragm by gastrophrenic ligament. And the whole body of the stomach at the greater curvature, it is attached to the greater omentum, whereas the lesser curvature of the stomach, it is attached to the lesser omentum. In the lesser omentum, it is attached to hepatogastric part. So these are the peritoneal relations. Now coming to the visceral relations of the stomach. Viscerally, the stomach is related anteriorly. Anteriorly, if you see, stomach is related to the liver. If you see, this is the stomach and there will be liver, that too left lobe of liver. So anteriorly, it is related to the left lobe of liver, that is one. Okay. That too on the right side, it is related to the left lobe of the liver, and on the left side there is a diaphragm and there is a rib cage which is covering it. So the left part of the stomach, left half of the surface of stomach, it is related to the diaphragm and the rib cage. The lower part of the stomach, if you see, this lower part of the stomach, this is related to the abdominal wall. So the one part of the stomach, it is attached, it is related to the liver. The other, that is the right side, that to the left lobe of the liver on the right side, whereas the laterally, that is on the left side, it is related to the rib cage and the diaphragm, whereas below the lower half of the stomach, it is related anteriorly to the anterior abdominal wall. Then what about the posterior relations? Posterior relations, the stomach, once if you have removed the stomach, you can see this. The stomach is related to the pancreas below, and there is a diaphragm which is below, and duodenum which is below. Normally the stomach is related to the diaphragm. There is spleen, it is related to spleen, and there is splenic artery. It is also related to left kidney, and it is also related to left suprarenal, that is adrenal gland. Okay, suprarenal gland, that is adrenal gland. So these are the posterior relationships of the stomach. So what is the main interior of the stomach? Interior of the stomach, if you see, it has a gastric canal for liquid passage. It also has gastric pits. These gastric pits are smaller impressions, and these smaller impressions, on these smaller impressions, gastric glands open, and it also has gastric folds. Whenever there is increased food, these rugae can become flat. These gastric folds can become flat whenever the stomach is distended. So this is the internal structure of the stomach. Now, the blood supply to the stomach. The stomach, it is mainly supplied by the celiac trunk. Okay, the celiac trunk, it gives common hepatic branch, splenic branch, and left gastric branch. Celiac trunk will give three branches. One common hepatic, then splenic, then left gastric. Left gastric branch supplies the lesser curvature of the stomach, whereas the right gastric branch supplies the lower half of lesser curvature of stomach. Not lower half, it is right side, right part of lesser curvature of stomach. Okay, that is right gastric branch. Left gastric branch and right gastric branch, both these will supply the lesser curvature of stomach. Right gastric branch is a branch of right gastric artery. It is a branch of common hepatic, as you can see. Left gastric artery, it is a direct branch from the celiac plexus. Now, the splenic artery, it will supply the spleen, and it will also give a left gastroepiploic artery. The splenic artery will supply the spleen, and it also gives one more artery, which is left gastroepiploic artery, which will supply the greater curvature. Whereas the right gastroepiploic artery, it is originated from the common hepatic artery, and this will supply the greater curvature. So there are also some short gastric arteries which are from the splenic artery. These also supply the stomach. So mainly, if you see, there are mainly four major arteries which supply the stomach. Left gastric artery, right gastric artery, left gastroepiploic artery, right gastroepiploic artery. But the major difference is left gastric artery arises directly from the celiac plexus, whereas the right gastric artery, it arises from the common hepatic artery, and even the right gastroepiploic artery, this also arises from the common hepatic artery, whereas the left gastroepiploic artery, it arises from the splenic artery. Then these are the venous drainage of the stomach. Venous drainages will correspond to the arterial drainage. So if you see, there is left gastric vein and right gastric vein. There is also left gastroepiploic vein, right gastroepiploic vein, and short gastric veins. So these will drain into inferior mesenteric vein. Mainly these will drain into the So the stomach veins will drain into the these veins, that is left gastric, right gastric, left gastroepiploic and right gastroepiploic. The left and right gastric veins drain into the portal vein, whereas left and right gastroepiploic veins drain into the splenic vein. If you see the left gastroepiploic vein, so just a minute, I'll just show you in the diagram. I'm sorry. Left and right gastric vein, this drains into the portal vein. So this is portal vein. Okay, if you see, left and right gastric veins drain into the portal vein, and left gastroepiploic vein and the short gastric veins, these will drain into the splenic vein, whereas the right gastroepiploic vein, this will drain into the inferior mesenteric vein. So these are the different venous supply of the stomach. Now let us learn about the lymphatics of the stomach. Lymphatic drainage of the stomach is divided into four. The stomach is divided into four parts for lymphatic drainage. First, the stomach is divided into two parts by the longitudinal. The stomach, through its longitudinal axis, it is divided into two parts by left 2/3 and right 1/3. Okay, by right 1/3 and left 2/3 through longitudinal axis, and then from the right 2/3, first the stomach is divided based on a longitudinal line which is drawn, which will divide the stomach as right 2/3 and left 2/3, left 1/3. This is right, this is left, so it is divided right 2/3 and left 1/3. The right 2/3 part is again divided as by a transverse line which will divide upper 2/3 and lower 1/3. Similarly, the left 1/3 is divided as upper 1/3 and lower 2/3. Now, the first one, it drains into right gastric node, left gastric nodes. The second one, the fourth one, it drains into right gastric nodes. The second one, it drains into right gastroepiploic nodes, and the third one, it drains into pancreatico-splenic nodes. All these nodes will drain into celiac nodes, and then to the other lymphatic drainage. So this is the lymphatic drainage of the stomach. Now let us learn about the nerve supply of the stomach. Nerve supply: the stomach has two vagus arteries. It is supplied by two vagal nerves. One is anterior vagal nerve, the second one is posterior vagal nerve. Anterior vagal nerve, if you see, this anterior vagal nerve has a gastric branch, celiac branch and hepatic branch. So anterior vagal nerve, it gives a hepatic branch and supplies the gallbladder and liver. It gives a celiac branch and it will supply the celiac plexus. It also gives a gastric branch which supplies the stomach. On the lower half there is nerve to lethargate. So this nerve supply is really important for the vagal selective vagotomy, highly selective vagotomy and truncal vagotomy. If it's truncal vagotomy, we cut at the trunk of the anterior vagal trunk, and as a result both the celiac branches, hepatic branches and also the pyloric branches and the nerve to lethargate, all these are lost. If it is a selective vagotomy, we will preserve the celiac branch and the hepatic branch, and we will cut at the here. So as a result the celiac branch and hepatic branch are preserved, so only the nerve to lethargate is lost. So in order to prevent even the loss of nerve to lethargate, we will just cut the parietal branches. So these are the branches which we cut. So when we cut these branches, the nerve to lethargate is also preserved. Okay. Now this is the posterior vagal trunk. Posterior vagal trunk also has a branch to celiac branch, and it does not have a hepatic branch. It has mainly a branch to celiac branch, and there is a nerve of Gracie, and there is gastric branch of lethargate. So this is the nerve supply to the stomach. So now I have completed the whole stomach topic. Just a brief introduction and a brief run through of the topic. I will try to complete like this the whole abdomen, and once I have done this, whenever I get good time, then I will try to upload all the lectures of abdomen in a better way. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.